Fibrodysplasia ossificans progressiva Stoneman syndrome. FOP is a progressive genetic disorder that turns soft tissues into bone over time. The ACVR1 gene found in bone, muscles, tendons, and ligaments regulates growth and development of those tissues, and is normally responsible for turning cartilage into bone as children develop. However, mutations of this gene can allow ossification to go unchecked throughout a sufferer's life, even turning skeletal muscle into bone and causing joints to fuse together, restricting movement. This disorder occurs in about 1 in 2 million people, and there are currently no treatments or cures. Trauma worsens the condition, so attempts to remove bone surgically just results in the body producing even more bone in the area. Cold urticaria, cold allergy. Cold urticaria, essentially meaning cold hives, is a disorder where hives or large red welts form on the skin after exposure to a cold stimulus. The welts are usually itchy, and often the hands and feet will become itchy and swollen as well. Hives vary in size from about 7 mm in diameter to as big as about 27 mm diameter or larger. The disease is classified as chronic when hives appear for longer than 6 weeks. They can last for life, though the course is often unpredictable. This disorder, or perhaps two disorders with the same clinical manifestations, can be inherited or acquired. The acquired form is most likely to occur between ages 18 to 25, although it can occur as early as 5 years old in some cases. Primary cold contact urticaria is a cutaneous condition and occurs in rainy, windy weather, and after swimming in cold water and after contact with cold objects, including ice cubes. Lewandowski-Lutz dysplasia, Tree-Man syndrome, colloquially known as Tree-Man illness, is an extremely rare hereditary skin disorder associated with a high risk of carcinoma of the skin. It is characterized by abnormal susceptibility to human papillomaviruses (HPVs) of the skin. The resulting uncontrolled HPV infections result in the growth of scaly skin, particularly on the hands and feet. It is typically associated with HPV types 5 and 8, which are found in about 80% of the normal population as asymptomatic infections, although other types may also contribute. The cause of the condition is an inactivating pH mutation in either the EVER1 or EVER2 genes, which are located adjacent to one another on chromosome 17. The precise function of these genes is not yet fully understood, but they play a role in regulating the distribution of zinc in the cell nuclei. Other genes have also rarely been associated with this condition. These include the RAS homolog gene family member. Xeroderma pigmentosum, vampire syndrome, is a rare recessive genetic disorder of DNA repair in which the ability to repair damage caused by ultraviolet UV light is deficient. In extreme cases, all exposure to sunlight must be forbidden, no matter how small. As such, individuals with the disease are often colloquially referred to as moonchild. This disease is present in both genders and in all races, with an incidence of 1 in 250,000 in the United States. Vampire syndrome is roughly 6 times more common in Japanese people than in other groups. Elephantiasis. Elephantiasis refers to a parasitic infection that causes extreme swelling in the arms and legs. The disease is caused by the filarial worm, which is transmitted from human to human via the female mosquito when it takes a blood meal. The parasite grows into an adult worm that lives in the lymphatic system of humans. Elephantiasis is typically characterized by a thickening of the skin and subcutaneous tissue that gives rise to the grossly enlarged and swollen limbs that earn the condition its name. The condition is also called lymphatic filariasis. The condition currently affects over 120 million people, with 40 million affected by a severe form of the disease. Elephantiasis is most common among populations from India. An Indian person is affected in 1/3 of all cases. Hypertrichosis, also called Ambras syndrome, is an abnormal amount of hair growth over the body. Extensive cases of hypertrichosis have informally been called werewolf syndrome, because the appearance is similar to the mythical werewolf. The two distinct types of hypertrichosis are generalized hypertrichosis, which occurs over the entire body, and localized hypertrichosis, which is restricted to a certain area. Hypertrichosis can be either congenital, present at birth, or acquired later in life. The excess growth of hair occurs in areas of the skin with the exception of androgen-dependent hair of the pubic area, face, and axillary regions. Several circus sideshow performers in the 19th and early 20th centuries, such as Julia Pastrana, had hypertrichosis. Many of them worked as freaks and were promoted as having distinct human and animal traits. Aquagenic urticaria, also known as water allergy and water urticaria, is a rarely diagnosed form of physical urticaria. The defining symptom is a painful skin reaction resulting from contact with water. It is sometimes described as an allergy, although it is not a true histamine-releasing allergic reaction like other forms of urticaria. This seems to not be affected by different temperatures of water, such as cold or hot, or chemicals such as fluorine and chlorine, since it is reproduced with distilled water and medical saline. According to Gerald W. Volchek, urticaria represents transient, localized areas of edema within skin tissue that appear as pruritic raised erythematous, skin-colored or white, non-pitting, blanching plaques of variable size. The term urticaria was first used by the Scottish physician William Cullen in 1769. Alien hand syndrome. Alien hand syndrome is a rare neurological disorder in which one hand functions involuntarily, with the victim completely unaware of its action. People who suffer from ARS have exhibited similar symptoms in certain cases. Less horrifying symptoms include involuntary reaching and grasping, touching the face or tearing at clothing. More extreme cases have involved involuntarily stuffing food in the mouth, preventing the normal hand from completing simple tasks, and self-inflicted punching or choking. While it's viewed as more of a nuisance than a medical threat, its sufferers often experience psychological problems and embarrassment and are occasionally put in harm's way as a result of the renegade limb's actions. Progeria. This is caused by a small defect within the child's genetic code. The disease has very hard and devastating consequences. Most children born with the disease will die by the age of 13. As the body's speed through the process of aging, they develop physical symptoms of older people, including heart disease, premature baldness, thinning bones, and arthritis. It is extremely rare, with only 48 people living with it throughout the world. No known cure exists. Children with progeria usually develop the first symptoms during the first few months of life. The earliest symptoms may include a failure to thrive and a localized scleroderma-like skin condition. As a child ages past infancy, additional conditions become apparent, usually around 18 to 24 months. Limited growth, full body alopecia, hair loss, and a distinctive appearance, a small face with a shallow recessed jaw, and a pinched nose, are all characteristics of progeria. Signs and symptoms of this progressive disease tend to become more marked as the child ages. Later, the condition causes wrinkled skin, atherosclerosis, kidney failure, loss of eyesight, and cardiovascular problems. Scleroderma, a hardening and tightening of the skin on trunk and extremities of the body, is prevalent. People diagnosed with this disorder usually have small, fragile bodies, like those of elderly people. The face is usually wrinkled, with a larger head in relation to the body, a narrow face and a beak nose. Prominent scalp veins are noticeable, made more obvious by alopecia, as well as prominent eyes. Musculoskeletal degeneration causes loss of body fat and muscle, stiff joints, hip dislocations, and other symptoms generally absent in the non-elderly population. Nodding syndrome. Nodding disease or nodding syndrome is a recent little-known disease which emerged in Sudan in the 1960s. It is a mentally and physically disabling disease that only affects children, typically between the ages of 5 and 15. It is currently restricted to small regions in South Sudan, Tanzania, and northern Uganda prior to the South Sudan outbreaks and subsequent limited spread. The disease was first described in 1962, existing in secluded mountainous regions of Tanzania, although the connection between the red disease and nodding syndrome was only made recently. Children affected by nodding disease experience a complete and permanent stunting of growth. The growth of the brain is also stunted, leading to mental handicap. The disease is named for the characteristic, pathological nodding seizure, which often begins when the children begin to eat, or sometimes when they feel cold. These seizures are brief and halt after the children stop eating or when they feel warm again. Seizures in nodding disease span a wide range of severity. Neurotoxicologist Peter Spencer, who has investigated the disease, has stated that upon presentation with food, 1 or 2 children will start nodding very rapidly in a continuous, pendulous nod. A nearby child may suddenly go into a tonic-clonic seizure, while others will freeze. Severe seizures can cause the child to collapse, leading to further injury. Subclinical seizures have been identified in electroencephalograms, and MRI scans have shown brain atrophy and damage to the hippocampus and glia cells.